From Alaska Teen Media Institute, this is Podcast in Place, Youth Stories from Quarantine, a series about youth in Alaska during the COVID-19 pandemic. We're bringing you stories, interviews, and audio diaries from teenagers and young adults stuck at home with nothing else to do. I'm ATMI senior producer, Cornilius Nelson. After spending the summer back up here in Alaska, ATMI producer Danielle DuClos returned to the University of Missouri, where she's a junior studying investigative journalism and pre-law political science. A few days after arriving in Columbia, Danielle started feeling sick. She got tested, and sure enough, she had contracted COVID-19. Don't worry though, she is fine. She has since recovered from it. Fellow ATMI senior producer Daisy Carter called up Danielle to talk about what it was like having the virus, the physical and mental effects it has on a person, and how her school has readjusted to life in pandemic. They spoke on September 25th, 2020.
How did you find out that you were exposed to COVID?
Okay, so I was coming back from my summer back home in Anchorage to Columbia, Missouri, which is where Mizzou is located. And so I was here for about 3 days and I started getting some sniffles, and I was like, well, coming back, new environment, could be allergies, could just be tired. Didn't think too much of it because I had been tested for COVID before thinking I had it and I was negative. So I was like, maybe I'm just overthinking again. And so then I developed a little bit of a cough, but it wasn't a dry one. So I was like, well, it's supposed to be a dry cough. And then I noticed my smell started to go a little bit, and I was like, well, okay, I don't know about that. And so then I had been home or back here for, I think, 4 days. And then at the end of the 4th day, 0 taste, 0 smell. And I was like, oh my gosh, I think I have COVID. And the next day I went and got tested, and then they called me that Sunday. So I got tested on Friday and they called me Sunday. They were like, yep, you have COVID. And when I went to go get tested, they were like, yeah, you have it. You're going to get a positive test result. There's no way you're not positive. And I was like, oh, great. This is wonderful.
What did you do when you found out you had COVID?
Honestly, I told my roommates, I was like, guys, I think I should go get tested. As soon as I lost my taste and smell, I was like, okay, I probably have it. And I knew coming back from Alaska, the case counts are they spiked in Alaska, but they're nothing compared to Missouri. Missouri's kind of a hotbed state right now. And my college town, at least last week, was the 6th largest outbreak in the nation per capita for COVID. So I kind of just knew coming back that I was going to get it, or that it was a very high probability that I would get it. So I was like, okay. So I started wearing my mask around my apartment and just kind of isolated in my room. And I told anyone who I'd been in contact with the last couple of days, I was like, guys, I think I might have COVID. I'm going to go get tested, but monitor your symptoms and I'll let you know my test results. But you shouldn't go home and see family or things like that. And so then the next day, my friend took me to go get tested. And it was funny because I just went to this clinic, because most places in Missouri require a referral, which you have to pay for. And that's expensive. And then you have to pay for the test. And they only have one place in Columbia that didn't require a referral. So I went there and there were all these frat guys in there, and sorority girls who needed to get tested because of Greek life stuff. So that was super interesting. I was like, oh my goodness, what's happening? And then, yeah, I basically just hauled out in my room for the rest of the time.
So you said that you started getting symptoms basically kind of right away, right as you landed. What was kind of the worst symptom, in your opinion, from your experience?
So I had the loss of taste and smell. The extreme exhaustion was something I wasn't expecting to be, I've never had mono, but I would say people describe mono as being you're deathly exhausted. I would literally do something for 20 minutes and have to rest for 4 hours in my bed. It was a lot. And then I did have shortness of breath. So I will say that was probably the worst symptom psychologically, because with all the news coverage and the fact that we don't know a lot about COVID and its long-term effects, we're still learning a lot about it. I was worried that it could get worse. So my shortness of breath wasn't awful, but the psychological fear of the fact that it could progress to a worser point and I could have trouble breathing, that was really the worst part of it, I would say. I've been sicker in my life, I will say that. Like, I felt worse, but the fear factor of it, like, I was crying one night. I was just like not okay. I had been isolating for a while, and I was like, what if I get silent hypoxia, which is basically walking pneumonia, and it's more common in younger COVID patients because it presents as shortness of breath, but then you don't really know that you have it until it's like at the point where you need to be hospitalized. And basically silent hypoxia prevents you from getting enough O2, like oxygen. And so I was just like, what if I get silent hypoxia? And I started crying and like freaking out because my sister was like, yeah, you got to make sure you don't get that. And I was like, why would you tell me that? Oh gosh, it was, yeah. So I would say the psychological part of it was probably the worst. And then physically, I guess I still can't fully taste and smell. And when they say loss of taste and smell, like you literally can't taste or smell anything. So then you don't really want to eat. And it's just like it's so odd. But yeah, I'm a big coffee drinker, and my taste of coffee is like not the same as it was before. It's so sad. I hope it comes back. And then I don't know if this is just me being me or if it's like actually there, but I do feel like I still have some of the shortness of breath symptoms, which they say can persist a little bit longer. Like, I can do normal things. I'm not as tired, but my like mile time for running is definitely decreased a little bit. So I don't know what's up with that.
What was your day like, an average day like with COVID?
Oh boy. So I have like all my classes are available to be taken online, which was great. So I would go to class virtually, of course, but basically I just laid in bed all day long and watched How to Get Away with Murder, because when I was at my sickest, that was all I could do. Like, I have this tapestry behind me that I ordered from Amazon, and I hung it up while I was like technically like had COVID, and it probably took me 15 minutes to hang up, but afterwards I was so tired that I literally rested for 5 hours and just in my bed. So really I just would go to class and take my notes and like do my homework and stuff, but I had like no motivation to want to do anything, because even mentally focusing I was a little foggy, and I just wanted to rest like all the time.
Did you take any like cough medicine, or like did you do any like special like thing for like cold or anything like that?
Yeah, so I did take some like Dayquil, NyQuil stuff just to help with like my stuffy nose and all of that. But I didn't really need any, like I would have been fine without it. So it was just to help things. I didn't ever have a fever, which was good. So yeah, I didn't really do too much medicine wise, and that wasn't super necessary, but I did have some body aches. So I did use some icy hot. I did use that.
Do you have any idea how you got COVID?
So a lot of people have asked me that. I have no idea. I did travel. So I think the fact that I say I travel, people are like, oh, that's how you got it. But I don't think that's necessarily a given. I did see a small, like I saw maybe 6 people like considered non-social distancing without a mask, like my close contacts, but none of them ended up having, I don't know, might have been asymptomatic and not known it, but I have no idea really. But what's interesting is like I was in close contact with my roommates and I was wearing a mask, and none of them got it. They all tested negative. And while I was traveling through the airport, I was social distanced the entire time and wearing a mask. So I feel as if I might have gotten it from like a person, like one of my friends who was asymptomatic and just didn't know it. But of course I'm not a public health official and I can't say for sure where I got it from. So, but that's my theory.
How's your school been like responding to that? Like, I don't know, like, if I get sick with COVID, like, how my university is going to handle it. So, I don't know, it was just interesting to see, like, what, like, a bigger university, like, how that's been going.
Looking at how Mizzou is handling it compared to other public universities that have reopened of similar size, I will say that I'm a little shocked about the way that they're handling it. There were no tests required for students before, like, you didn't have to have a negative test before coming back. especially even if you're moving into campus housing, like you could just move in. They didn't have free and easily accessible testing widely available for students, which was also a little surprising. And the process, I guess, after I tested positive for how it would go from there was lacking, and the communication was not, there wasn't really that great of communication. I didn't know what I had to do or what was required of me as someone who had COVID, which I feel like that should be a main thing. Like you should be having open communication well with students and people who test positive. So I did have like a care, they have like an MU care team person that's assigned to like check on your well-being. But I will say I technically still haven't been contact traced. I still haven't been contacted, and it's been, I want to say, a month since I got my like positive test result. And I did all my own contact tracing basically, and was like, as I said earlier, go get tested if you feel symptoms, or you should just monitor yourself. And all my friends did, all my roommates got tested. And the contact tracing was very backlogged. And so I had to kind of advocate for myself and be like, I haven't heard from anybody. It's been so many days. I'm reaching the end of my isolation period. My doctor told me, 10 days of isolating. And if you don't have worsening symptoms or fever within the last 72 hours of that 10-day period, you're good to go back to school. And then what's interesting is like they say you need to be released from isolation by your case investigator, but I had never been contacted by a case investigator, and no one was asking for my like release from isolation. So I was like, do I need a letter to go back to school? And if I go back to school without the letter because of the delayed contact tracing, would I be disciplined? Because like a lot of universities are like, you can be subject to the code of conduct for violating these rules. And so that was like an interesting dynamic that wasn't really well communicated about like what could happen to me or what I should be doing. And so I was like, do I need a letter? And the people who were supposed to be knowing about all this, like in charge of the care team and stuff, were like, well, we don't really know. And then they're like, yes, you do. And here it is. But no one ever asked me for a letter or anything to say that I could come back. I just came back. So I don't know. I would say it was a more complex and confusing process than I think it needed to be. But I will say, because there's like this interesting caveat. So all of my roommates are obviously close contacts of me because I live with them. And so they should get tested, because technically from my last day of isolation, they have to quarantine 2 weeks after that. So it could be up to a month of them like isolating and quarantining to make sure that they don't get sick. So if they get that negative test result, then they can just go back to their lives. But you need a referral. And in order to get a referral, you either have to pay for it. And a lot of insurance companies like just won't pay for it without you being given a contact trace like reason. And then the contact tracer counts as a referral. So the insurance will be like, okay, I'll cover that. But because of the delay in contact tracing, my roommates couldn't get that referral necessary. And like certain insurance companies, like one of my roommates, like they won't cover the test unless you have a referral. Like there's just so many, like it's cyclically eating, it just doesn't work out when the system isn't working properly. So there's definitely, I will say, considering how long they had since we shut down in March, I was a little surprised at the way everything was functioning, given the fact that they had like 6 months to figure it out.
Yeah, no, definitely. I still can't believe that we're this deep into like quarantine and people are still like, it's a hoax, or like, I'm not going to wear my mask. It's like, are you kidding me?
Yeah, that's something that's super interesting coming to Missouri too, where just the feelings about the virus and like that idea of like, it's not that big of a deal or it's a hoax or whatever, is super interesting compared to Alaska. It's also interesting to see the amount of like young people, and I don't want to like blame young people because it's not just us who are contributing to this problem, like it is a full societal thing, but at least like on a college campus, the amount of people who are like still doing all these like parties and things like that and going to gatherings, like our bars may be closing sooner and things like that, and you can't have as many people, but people are still having parties at their apartments. It's just in a different scenario.
So for your county, I guess it's 20 people. It's less than 20 people instead of like 10.
Yeah, I believe that's what it is. And it's a little like things are different for sure. We have like Anchorage, we have a mask mandate. And then Mizzou has kind of its own guidelines that pretty much align with that of the county. You have to wear a mask in class, and I do have in-person classes, so most of my classes are in person. The desks are socially distanced, but I do have like a class of 70 students that I go to, and we have social distance desks and we have masks, but I'm still in a room with 70 people. Like that is still a thing that's happening. So I don't know about that and how well that adheres to stuff or doesn't, but different world.
You mentioned a little bit earlier how mentally it took a toll on you. So like physically it also kind of took a toll on you. Can you kind of like elaborate and kind of explain about like how that was like?
Yeah, so the mental aspects, like the psychological part of it, even aside from the fact that having COVID is scary, having to isolate, I'm a big, like I love going outside and running. And when I'm home in Alaska, I love to hike all the time. And I'm a very social person. And so having to like stay in my room and like not communicate with people, like I could talk to them obviously like on FaceTime and stuff, but not really like hang out or, like all of that just like compounded, like being in this one room inside, plus I was sick, plus I was scared, all of that kind of like I started freaking out a little bit sometimes, I'm not gonna lie. So that was a little hard, and especially like living 4,000 miles away from my main support system of my mom and my sister. When you're sick, like obviously you want to have your family there to take care of you. So I kind of was like, man, I wish I was at home, but also my mom's like 60, and so she's at the higher risk. So I was glad that I didn't get it and like give it to her. I was a little bit worried about that this summer of possibly getting it and passing it on to my mom. I felt guilty. I felt really, really guilty for getting it and like making my roommates quarantine. So like that mental part of it, like I felt so bad because I mean, they have lives and jobs and things, and they didn't even have COVID, but they had to like quarantine to make sure that they didn't. And I would have just felt so bad had I given it to them. And I had done pretty much everything I was supposed to do. And I didn't like fully quarantine for 2 weeks after traveling with my friends because like I didn't think I had gotten it, and I wasn't going to wear a mask around my apartment because I potentially could have gotten it, but I guess I probably should have. But they didn't get it, so I guess. But I don't know, that whole part of just the guilt of having gotten it and possibly giving it to other people kind of ate away at me for a little bit, and I felt bad.
So now that you're kind of at like the end of like COVID, like can you kind of talk a little bit about the process of like getting like the negative result and kind of like the lasting effects you think that COVID's going to have on you like physically?
Yeah, so I actually haven't gotten like a negative test result. Like according to the CDC, you can test positive for COVID like even a month after you've been infected, and even though you're not contagious. So that wasn't like a requirement for me to have a negative test result before going back. It was more of like your symptoms go away. And about 3 days before, 3 or 4 days before the end of my isolation period, I wasn't tired anymore. Didn't really have like, my shortness of breath wasn't associated with like just normal life, which was what it was doing. Now I have a little bit when I like heavily exercise. And then the only thing that was there, like my cough went away, my runny nose went away, and the only thing that was left was like my taste and smell, which had started to come back. But since we don't know the long-term effects of COVID, that's something that kind of weighs on me that I think about. Like, do I potentially have like heart inflammation or heart damage, which can like, they've done studies to show that some patients do have that, like similar to a minor heart attack. And so that is a little worrisome, of course. And I don't want to like be older and have health problems that were because I got COVID at 20 and I'm like 40 and I'm paying the price for having like gotten this disease. Which, I mean, I'm healthy, I'm fine, I lived, and I'm doing like great. But like that also could have not been the situation too. I don't have any underlying health conditions, which is really great, but all of that, like this is a best case scenario, I feel like, for how it came out, but that's not the reality for everybody. And so having had COVID, and even though I'm fine, like it's serious. Like you need to take this seriously. It's not just some cold that you get. And I know I said like I've been sicker before, but that doesn't mean you should get it. You know, a lot of people are like, well, it's not that big of a deal. Like, no, it is. And you should wear your mask because it works. I literally lived with 3 other people with COVID, and I wore my mask every time I was not in my room, and they didn't get it. So that shows, like, that should show that wearing a mask works, and you should wear it. That's my little PSA there.
Yeah, that was actually my my next question. You know, having gone through COVID, like, what is kind of your advice, or what is kind of your takeaways that you think other people should know?
I mean, take it seriously, of course, because you don't know. Like, so basically every single one of my like close friends, not who I live with, but like other friends have gotten COVID through some way. Like, my friend was asymptomatic and she gave it to her roommate, but she got it from her symptomatic brother. So like all this stuff, you don't know if you don't have it. And I heard this great advice from our health department in Boone County, which is the county I live in, that was like, you should treat everyone as if they're positive with COVID. Like, that's how you should interact with people. And I think that's really true, especially among like our age group, where I feel like being asymptomatic is more common than being symptomatic. Like, my friend, one of my best friends, she was completely asymptomatic, and she would never have known that she had COVID unless like her brother had been positive, and she was like, I should probably get tested, but she wasn't even going to get tested. And I was like, you should do it. So, I mean, I would say if you feel like you might have it, or you might have come into contact with someone, get tested. And it's not enough to just be like, oh, it's 4 days without symptoms, and so I'm probably good. Like, if you come into contact with someone, you need to like do the whole 9 yards. Like, it's 2 weeks of your life, or maybe 10 days or whatever it is, but it's only 2 weeks. Like, your life will continue afterwards if you quarantine. And I feel like that guilt of having given it to a bunch of other people, that'll like affect you for the rest of your life, especially because you don't know people's medical history. You don't know what their lives are like. You don't know if they have an underlying condition, or if they're immunocompromised, or if they have family members who they care for who are immunocompromised. Like, you just don't know about other people's situations. And so it's like, you have a duty as a citizen and as a person in society to protect your fellow human being. And you should wear a mask, and you should be like social distancing and doing all of those things. Like, that is important, because in the case that you do get COVID and you become positive, you don't want to be that person who gave it to like 50 people or cause the next outbreak, you know? And this may sound like cliche to what everyone's saying, but like, we will get through this, you know? And we just need to like follow the guidance, because it does work. And if you do everything you're supposed to do and you still get COVID, then like, that happened. But I feel as if you're not doing what you're supposed to do and then you get it, it's like, come on, guys. Let's just, you know, get it together.
Yeah. Thank you so much for letting me interview you. And I hope that you get your full sense of coffee taste back, because I think that's the real tragedy.
It really is. Thank you. Yeah. I want that back ASAP. Thanks, Daisy.
That was Danielle DuClos speaking with fellow ATMI producer Daisy Carter about her experience of having COVID-19. You've been listening to Podcasts in Place, Youth Stories from Quarantine from Alaska Teen Media Institute. Our show's theme music was composed by Devin Schreckengast. Stay tuned for more stories from quarantined youth. You can find these stories at alaskateenmedia.org, where we include resources for youth during quarantine as part of a partnership with the State of Alaska Division of Behavioral Health. Many thanks to our supporters of our podcast, including the Anchorage Museum at Rasmussen Center, United Way of Anchorage, the Alaska Humanities Forum, and the National Endowment for the Humanities. The views expressed in this program do not necessarily represent the views of the National Endowment for the Humanities or other sponsors. Thanks to our listeners who contribute to our programs and help us leverage additional funds and grants. If you'd like to support Youth Voices in Anchorage and help keep our podcast going, you can donate to our organization by going to alaskateenmedia.org and clicking donate. Also on our website, you can learn more about what our organization does, listen to past episodes of our podcast, or find out how you too can get involved. You can also follow us up on Facebook, Instagram, and Twitter. For Alaska Teen Media Institute, I'm Cornelius Nelson. Thanks for listening. Stay safe out there, wear a mask, we'll get through this together.